Alrighty. Good evening to everybody. I am Major Jerry Martin. I'm the Canadian Forces Medical Liaison Officer and co-chair of the Patient Family Advisory Committee. Really happy to see so many people online and coming out to a new initiative that we have done with the CFMWS US, which is Healthcare 101. One of the most frustrating parts, I think, of some of an OUTCAN experience can be navigating US healthcare. And we're hoping to break down a lot of the barriers to this and give you tools and tips and tricks that not just coming from myself, but coming from families that have navigated this for quite a while. So, as I said, um, Major Jerry Martin, I'm based out of Washington, D.C. I work out of the embassy along with the debt. I have a couple members of my team online here, and I will introduce them later on during the presentation. So tonight, what we're hoping to run through is three main sections. One is just trying to get an understanding of U.S. healthcare. There's a lot of new terms. If you just moved down here, or even if you've been down here for a few years, sometimes it's good to know the language and have a better understanding of what insurance is and how it's applied down here. We hope that sort of pulling back the curtain on that will help people understand how to talk to clinics and insurance providers in a more informed way to help navigate some of those issues. Once we have a better understanding of US healthcare, we're going to go into how do we access healthcare well in the US, focusing mostly on the families. Our CAF members have a lot of briefs on this, and so we realize that we have really not given as much ammunition to our families, and so that's going to be sort of our focus there. And then we're going to switch into healthcare claims tips and tricks. We on the Patient Family Advisory Committee talk about this a lot. We have some really knowledgeable people there that are going to that have shared resources and ways to help manage claims, how to keep track of things and keep on top of things. My hope is that we're going to get through this in about the next half an hour and then have time for questions after that. So the first thing we have to know is the language. So these are some key terms and abbreviations, and I'm going to highlight the fact that you don't have to write these down. We're going to send this out after the fact, but we do also have this put up on our website, and you'll see me reference the website quite a bit, as well as show you later. I'm going to do a brief walkthrough of it. So few terms that we want to highlight though is on every base, there's a beneficiary counseling or an assistance coordinator. Sometimes on an Army base, if you're on an Army base, may be called a managed care coordinator. But the primary term that they use is beneficiary counseling assistance coordinator or BCAC. And if you send us an email, that's often the first person that we're going to say, hey, have you talked to a BCAC? And that's because this is a TRICARE representative who's in the military treatment facility to help you navigate insurance issues. They're there in person and they're always willing to help Canadians. Your beneficiary DOD number is going to be super important to know. It's going to be on the back of all your IDs and it's tied to the CAF members sponsor beneficiary DOD number. And this is the number that's going to be given to access healthcare. It ties to your benefits. And so making sure you have that written down. There's a whole bunch of terms when it comes to insurance that you might not have heard before. One that recently came up this week that we want to highlight is something called a catastrophic cap. And this is the maximum amount an individual or family will pay out of pocket for TRICARE covered services each calendar year from January 1st to December 31st. So these are things like your deductibles, your cost shares, your prescription coverage, your co-payments. If you're seeing healthcare a lot, those costs can add up. But eventually, if you hit that cap, then you move to 100% coverage. And this is spelled out in the TRICARE cost sheet every year, what value that is. So this is something that you may see. If you're paying for like premiums or if you go to a non-network provider, which we'll talk about, those don't go towards your catastrophic cap. Coinsurance is a percentage of covered costs that you pay after meeting your deductible. And it's typically around 20%. So this is something that we can kind of understand from being back at home, where prescription coverage is 80%, So our co-insurance is 20%. A copay or a copayment is a fixed amount you pay for covered healthcare services and prescriptions defined by TRICARE. It's set on the annual TRICARE cost sheet and it varies by service type, but this is where you'll see a copay of $32 if you go to a primary care physician. And this is the same amount no matter if that physician charges TRICARE $5,000 or $40. So that copay amount doesn't change. And cost share really just describes those terms. So if you hear the term cost share, they're talking about any generic thing that is you're paying your money to help subsidize healthcare costs with the insurance. DEERS is the Defense Enrollment Eligibility Reporting System. And we're going to talk about DEERS in a bit, but it's going to be a key part of starting off the right way. So that's something you're going to want to know. Your deductible is a set dollar amount that the patient's going to pay before TRICARE is going to kick in. This is again set on the cost sheet. And so as you start to pay healthcare at the beginning of the year, your first few clinician visits are a higher dollar value until you pay your deductible. Then you're going to see just your copay amount on the rest of your things. All deductibles, just like your copays and your co-insurance payments, can be claimed through MSH International for reimbursement. EOB, or the explanation of benefits, is a notice from your healthcare insurance, either TRICARE or MSH International or the Public Service Dental Care Plan, which explains what was paid for and how much. This is going to be key because it'll also outline why payment for services was denied and will give you other dollar values that are potentially claimable through things like the foreign service instructions. The FIN number is one that we wanted to highlight because you get this given to you once. It's typically when you're at DEERS, they'll write it on a sticky note, but you need to remember it for your entire time in the US. If you did not get this when you went through DEERS, that's fine. You can obtain it from the DEERS office for each family member. This basically serves as your social security number for the US. It's your foreign identification number. It ties to your medical record. And sometimes if you're booking appointments, you may need the last 4 digits of your sponsor's foreign identification number in order to verify your insurance. Generic terms are things like installation or base. So that is just what the US military calls their bases. So you may hear like you need to go on to the installation. It's just a term that we want to highlight that's different. Medical advance request are advances that can be given from the Crown to help cover the medical expenses that we're facing down here while waiting reimbursement. So these are Crown advances that need to be repaid by a CAF member, but what we don't want to do is have people carrying financial burdens while down here. So we want to go through the fact that this exists, and you can contact the Health Services Debt Washington team to arrange any of these. MSH International is our plan administrator for the Public Service Healthcare Plan for any individuals that are outside of Canada, whether you're posted OUTCAN or you're traveling outside Canada for leave or any reason like that. An MTF is the military treatment facility. And that's very common language if you're going to phone and talk to my team. We sometimes forget that people don't know what that is. So MTF is definitely where any of the clinics are on base. Network provider. So this one's a key one. So when we're talking about TRICARE or any insurance network in the US, they have what's called a network provider. So in network versus out of network it means that if they are in network, this provider has entered a contract with TRICARE to meet certain treatment and billing thresholds. So that includes referral timelines, documentation, and dollar amount. So these are ones that you're going to have those set copays or cost shares based upon the TRICARE cost sheet because they've entered into that agreement with TRICARE. And out-of-network providers is any medical provider that is not in that agreement with TRICARE. You can still see them, And TRICARE will still cover whatever they would have covered for that service for an in-network provider. But that provider is under no obligation to not come to you as the patient then afterwards to try and recoup that difference in dollar value. So if you go to an out-of-network provider, then you can have a lot of additional costs come up there. Okay. The Patient Family Advisory Committee is a group of volunteers, including uniformed members and family members, that are supporting my team to promote awareness around healthcare challenges for the OUTCAN USA community. Some great initiatives that have come out of that is actually this briefing that we're doing tonight, as well as our website. And these are people who have become more knowledgeable because of their close work with our team and serve as community resources for you at your locations. And we try and recruit from as many locations as we can, and you'll see a call out for that later. But also just advertise that you do have people in your area who are either a CAF member or a family member who can sort of be a first line of contact if you're dealing with issues. PSHCP is our public service healthcare plan, and PSDCP is our public service dental care plan for down here. Another term that many people don't know about is what's called an R70 code. And this is a reported coverage limit from MSH International on healthcare costs that are above the limits that they can reimburse. MSH International, when covering healthcare, can cover up to 3 times what that would have cost in Ontario. After that occurs, they won't pay any more money towards yourself. So they'll have a patient pays dollar amount on your explanation of benefits. And then on the bottom, there will be an R70 code. And it'll say R70, and it'll explain a reason why. This amount can be submitted through my team to claim through the foreign service instructions. And I'll show you an example of that later. And then the RHCA, or a Reciprocal Healthcare Agreement, is an agreement between Canada and the United States that really does govern why we can access care the way we can. So let's go through some just basics of insurance. So everybody here, if you're a CAF member or a CAF member's family that's on a DoD, Department of Defense spot, are sponsored to have TRICARE insurance. TRICARE is the primary U.S. military healthcare coverage. They are a large insurance company that does both on-base care and off-base care. So all of the on-base military treatment facilities and hospitals are actually all TRICARE facilities. And then they have a network of physicians off-base that have agreed to be in their network of providers. Their primary responsibility is to ensure benefits are provided to military members and their families. And then they oversee the 2 administrative deliverers. So in the East Coast region, it's Humana, and in the West Coast region, it's TriWest. TriWest and Humana are the people who actually apply the plan's benefits. And so that's the reason why I explain this is that there's 3 layers. There's the Defense Health Agency, which is the healthcare headquarters for the U.S. military. They tell TRICARE what to do, and then TRICARE tells Humana and TriWest what to do. So sometimes when we're navigating issues, it's important to know that because TriWest and Humana may be doing something wrong compared to TRICARE, and TRICARE may be doing something wrong compared to Defense Health Agency. And there's different ways that we can sort of weave through how we fix those problems. Now, on top of TRICARE insurance for the US, we have Canadian-based insurance. That's the Public Service Healthcare Plan, which is not recognized as other health insurance in the US. So this is something that we should never list as other health insurance or basically be telling the US individuals that we have this. This exists back in Canada for us to claim costs that we have incurred here for healthcare. It's coming from the Public Service Healthcare Plan as Canadian military healthcare coverage, and it's responsible for ensuring the benefits for CAF families. Now, Public Service Healthcare Plan oversees MSH International, and then the person who oversees both of those is the Treasury Board Secretariat. And I paint that because MSH International doesn't always do what the Public Service Healthcare Plan wants it to do, and the Public Service Healthcare Plan doesn't always do what the Treasury Board Secretariat. And we have ways to sort of fix through all of those problems as well. So what do you have through TRICARE? So TRICARE, because of the reciprocal healthcare agreement, you have eligibility for what's called applied benefits. But to get this done, it starts at DEERS. So when you go to a DEERS office, you're going to have a list of things you need to bring. And this list is actually outlined on our website. But what they're entering in the computer is basically a lot of demographic information, and then they start putting some codes in. And those codes define what you are eligible for benefits. So we've worked actually quite long to figure this out. They're called Healthcare Delivery Program codes, or HCDP codes. And if you are a CAF member, your code needs to be 011. And if you are a family member or of a CAF member, you're 012. This will ensure that you get the appropriate benefits applied onto your account. Now, one of the problems we have is as foreign individuals, we're not allowed to be enrolled in these plans. So unlike everybody else who gets enrolled in TRICARE, we just have, it's basically like a piece of paper sitting on top of a file that says this person gets all the benefits that if you're a family member, a TRICARE Select Group B individual would get, and if you're a CAF member, a TRICARE Prime member would get. Well, why this matters is that sometimes as people look in the system, they'll say, oh, you're not eligible for anything because you're not enrolled in the TRICARE program. And that's why we need to know that we go, hey, no, that's okay. We're foreign military. We don't get enrolled. We have applied benefits. And I'll go through some of those troubleshooting things later. Now, when you're registering at DEERS, if you were previously deployed with the US military or you just went on a deployment and came back, the member may be entered as 013, and this will overwrite everybody's codes and it won't be correct. Now, when you're done at DEERS, you're going to be given an ID card. And your ID card should look like this. And I'm going to use my little highlighter here to show a couple of things. One, it says foreign affiliate military on the sponsor. But what you want to look for on the front is that you have this authorized patronage, commissary, MWR, and unlimited exchange. The reason why is that if that's on the front, they've put in the code correctly. Then if you're the CAF member, you're going to look on the back and it should say outpatient direct care at no charge, inpatient direct care at a fully reimbursable basis. That's not 100% true because that's the baseline for foreign military. We have agreements on top of that, but that's what it's going to say. Your spouse's card and any kid over the age of 10 that needs to get a card should say the same thing. Authorized patronage on the front. And then on the back, it should say outpatient direct care at no charge, inpatient direct care on a fully reimbursable basis, outpatient civilian care on a fully reimbursable basis. Again, that's not actually true. We have benefits on top of that. However, this is how you know that you have the right code put in. If you get your card, quick check, you can look right away. And if that doesn't say that on the card, you go, hey, I don't think I'm coded right in DEERS. Okay. If you ever are facing issues, we can find out how you're coded in DEERS, myself and my team. So that is our eligibility in our enrollment for TRICARE. Let's just switch gears and we'll talk about MSH International. So when we're in Canada, our public service healthcare plan is listed as supplementary insurance. So once you get posted to outside Canada, you switch to comprehensive insurance. And this incurs at the gaining unit's orderly room. If this is done before leaving Canada, it'll be ignored by the public service healthcare plan. So you're going to have to do it again when you arrive. It's part of your in clearance. And it does take about up to 2 months for the public service healthcare plan to action. When it is actioned, you're going to get a notification from them by email. And you can also see a change in the cost from $4 to $4.01 on your pay stub. Now, if you haven't heard anything after 2 months, you're going to come back to us and just make sure. Okay. Now, the key with this change is that once it's changed to comprehensive, you then have to enroll with MSH International on their website. and set up a login. And you do that on the comprehensive side. And then once you're registered for both, you can upload your payment preference form, and it's found in the forms and key documents in the portal. We have the link to the portal here. But the key point is that sometimes people they either sent the form in back in Canada and then they're waiting, or they don't get to the form in time when they arrive and they're waiting for this to occur. And this change won't happen automatically, but it will get backdated to the day you cross the border. So if you have healthcare claims that arise, you can wait to claim them until this gets activated. It doesn't have to be claimed right away. The other part with MSH International for our eligibility is that you can claim any healthcare for up to 365 days after the end of the calendar year that it occurred in. So if you saw a doctor in 2024, you have until the end of this year to submit a claim for that healthcare. Anything you see this year, you have until the end of 2026 to submit a claim. Now, if you submit a claim and issues arise and it's not settled in that same time period, that's fine. We can sort that out, but hopefully we're not going to see that too often. So just the comparison of the two coverages. TRICARE Select, when you're going, referrals aren't required for most primary and specialty appointments here in the US. You may need some pre-authorization from your regional contractor for some services, but you're going to be told that when you're talking to the doctors. Copay and deductibles will apply to your TRICARE Select plan, but those are reimbursable through MSH International. Some services are not covered, so you do have to double check your coverages just to make sure that TRICARE covers whatever you're trying to do, i.e. massage and acupuncture are not routinely covered by TRICARE. Some of these things may be fully covered, though, by MSH International or partially covered. TRICARE does not cover dental for family members. That is all going to go through our public service dental care plan. For most people, there's no inpatient coverage. And I'll go through where that does apply for some people in the US. And then if we're ever having any problems with our TRICARE insurance, our primary point of contact is going to be the Beneficiary Counselor Assistant Coordinator, or BCAC. Do not call TriWest, Humana, or TRICARE directly. They're not equipped at their call centers to help deal with foreign individuals. From an MSH International point of view, it's utilized to cover the costs for inpatient care and any of the cost shares from TRICARE benefits, but there's no direct billing option. So all services are paid as self-pay and then claimed after the fact. And that's where we can assist you with medical advances. To find out what is covered, same thing, check your benefits. It's very important that you know your benefits before you go. And again, most costs are paid up to 3 times the OHIP rate for Ontario. However, if the cost of healthcare is over top of that, there are foreign service instructions that help us recoup those costs as well when you're outside of Canada. So you can always talk to us about those. How does the billing process work for TRICARE? So TRICARE is going to be your primary insurance while you're down here. You're going to provide your doctor's office with your DOD ID and your ID for ID number and your ID card. And they're going to use that to direct bill. You may also need your spouse's last 4 numbers of your FIN. This is something new I learned. It seems to be variable, but sometimes it is required. You may be asked to pay your copay before leaving the office, or you may be billed after. There's different practices, okay? But you do expect, if you're not at a military treatment facility, to pay a copay. Copays are going to vary depending on the services, and those are sent out by TRICARE and set by TRICARE. If the doctor's office states that you're not enrolled in TRICARE, just let them know that you're a foreign active duty family member and that they can contact their regional provider TRICARE rep to verify your insurance. This is a pretty common thing that comes up within the billing process. And so this is something I want to stress, is that the people who assist the doctors are very knowledgeable in how foreign individuals are supposed to be looked after. But the doctor's office is just going to be able to see what they can see. And so knowing the right words, foreign active duty family member, I have applied benefits, I'm not enrolled, contact your regional provider TRICARE rep. These are types of things that are going to help you be able to have those conversations with the doctors. Tip is when you're making your appointment off base, you can ask the office what your copay is going to be. Just a reminder of the regions in case you don't know which region you're in. TRICARE, Tri-West is the Western US and the states are listed there. Humana is East. And just a brief note on inpatient care. So the reciprocal healthcare agreement was signed just this year. It's good for the next 5 years. Um, so if you reside in Washington State, California, Hawaii, Texas, Maryland, Virginia, or the District of Columbia, and you get admitted to a military hospital, not a civilian hospital, a military hospital, whether it's for the military member or their family members, that's at no cost. Um, all other states, if you get admitted to the military hospital, there will be a bill associated with it. If it's the military member, quite often they just bill our government. But if it's a family member, you'll see a bill that comes to you for reimbursement of the cost of care. That's claimed through MSH International. If you're ever admitted to a civilian inpatient hospital in any state in the US, that's going to be covered by MSH International for our family members and my team for any military members. That's a sort of a nuanced thing. The reason why it's only those states is because we have more Canadians in the US than they have Americans in Canada. So to balance the costs of healthcare between the two, they've restricted to just those states. So billing process for MSH International. So it's a secondary insurance to cover those costs that come up through TRICARE or if you end up admitted. The easiest way is to make a claim online. You just follow the prompts and you answer the questions. But the problem is you do have to submit one invoice at a time. The best practice is to include your TRICARE explanation of benefits, your bill showing your TRICARE payment, and your in proof of payment. If you show all three of those things, that we find that 95% of the time we're not seeing any problems with this. The one thing with this portal though is that it doesn't notify you when your claims are done. So you do have to check back constantly. And we're going to give you a tracking spreadsheet that you can use to help sort of keep track of that on your own. So this is what an explanation of benefits is going to look like from MSH International. It explains what was paid and what wasn't, and explains why services were not covered. So in this case, it looks like these two things for whatever it was, looks like vision. Your plan does not cover the charges for a product protection plan, and your plan does not cover a product protection plan. So those two charges weren't payable on this explanation of benefits, but you can see that everything else was payable, at what percentage it's payable, and then this dollar value there would be what we call a coinsurance. So the MSH reimbursed this much. For TRICARE, they look very similar. Here, the biggest part is that this is the patient responsibility, and this is the dollar value that you can quote on your claim to MSH International. So you can be reimbursed that. Okay. Same thing, if there's a denial, there'll be a reason in a box here. Okay. Now, here's another one from MSH International, and unfortunately it's quite small, but this one, you could see that they reimbursed $577, but the members still had $360 that they were responsible for. But then down here, it says code 1, R70. Reimbursement is limited to the amount payable under this Health Insurance Act. So this $360 now is claimable through my office. And so this is an example of an R70 code. The other part is with dental, because dental is very expensive down here. If you submit, you'll sometimes get this, which is called an excess dental letter. So here, the out-of-country plan member share was $68. Ontario plan member would have had to pay $46. So there's a difference between the two, an excess dental expense of $22.50, and that is payable through us. And so these are things that are calculated by our insurers. And so if you ever get letters that have an excess dental or an R70 code, that's where you contact our office to claim them. Okay, so how do we access healthcare? As members assigned to a US installation, your families are going to get access to that same US installation. For the most part, most US clinics treat family members as well. There's a few exceptions that don't because of the space available and shortages of clinicians. However, if the military treatment facility sees US families, it will see Canadian families. This also includes mental health and behavioral health supports. But if you're having trouble in your area getting mental health and behavioral health supports, most US units have what's called a first shirt. And your CAF member will know how to get in touch with the first shirt. This is a senior NCO that's trained on how to provide resources for family members on all of these topics. So that's a good resource. The other resources to come to us, and we'll also give you some mental health resources at the end. Now, you can choose as a family member to be seen on base, and most bases will have family doctors and pediatricians and some specialists, um, or you can choose to go off base. It is your choice. You can also do a combination of both. Okay. The key point is that if you're going to go off base, on the key differences on base is that you're going to have no cost associated at all. Your prescriptions, your care, you'll never see a bill from them at all. And so that's a little bit easier. One of the problems though is that we don't get assigned a primary care manager, which is the equivalent of a family doctor. And so you can request to see the same doctor in the system, but it's a little bit harder sometimes to get in on those appointments. Um, as I said, in some locations, Tinker, Tyndall, even Peterson is starting to get more. We are seeing limited access because of shortages of clinicians. And so in that case, you're going to be told, hey, you can't book, and then you have to go off base. So when you're going off base, be aware of in-network and out-of-network. And we're going to give you some resources of how to find in-network providers. Your copays will always be higher out of network. And so that's just a risk that you take when you book with those people. And you're going to have more bills to track if you go out of network. The other part is that if you ever end up in hospital or the emergency room, you may get multiple bills for the same visit because providers will bill for their services separately. You'll get a bill from the hospital, you'll get a bill from the emerge doctor you saw, maybe the specialist you saw. It's not all going to be put together in one bill like it would be in Canada. It's going to be separate bills along the way. That's why we've pulled a tracker to help you along. And then you have to submit your own claims. There's no direct billing through MSH. For hospital, if you're on base, if there's a military hospital in your area, you can utilize inpatient care. And if you're in one of those reciprocal healthcare agreement states, you won't see a bill. If not, you will get a single bill from a military hospital for reimbursement, which is nicer. If there's no hospital and you're admitted to an inpatient civilian clinic, no military hospital, I should say, you must use MSH International. You're going to identify yourself as self-pay, which is going to give you a lot of discounts on healthcare here. If you go to an emergency room, you're considered outpatient unless you become admitted to the hospital. And there's a key point there is that that's all going to go through TRICARE. And then the minute they come to you as a patient and they go, or your kid or your like CAF member, and they go, hey, we're going to admit you to the hospital, that becomes inpatient care now. So it's a key distinction to know the difference between those two, because then when you're an inpatient, if you can talk to the billing department, you can tell them, hey, I'm actually not eligible for inpatient services through TRICARE. I'm going to be self-pay, and then that will help us sort out your bills along the way. If this happens, I want to say it's key to loop my team in early so we can help you walk through that. There is a patient portal that's the MHS Genesis portal. This gives you records to your health records. You can send messages to clinicians. The easiest way to sign up for this is to get the handout from your military treatment facility. The key point for our family members is that you have to have an email on your DEERS account that is linked to you individually. So if that doesn't happen at any time, you can actually update that with them. There's this self-service site, or you can call DMDC Support Center and get an email added to your DEERS profile. And then once you get that, you can get this login, and it's very helpful for managing your appointments. Okay. We're not experts at this, but we can definitely help you with that. But it is a very useful resource. For appointments on base, you may need to contact the appointment line or use Genesis that I was just talking about. The Military One Source is a great spot to get the phone numbers for your location. You enter your installation name, you locate health, and it'll give you the phone numbers to call to book appointments on various departments. When you call, you need to remind them that you're NATO and you do not have a PCM, because sometimes they'll be like, "Oh, you're not registered for this clinic," and that's where you can say that. Okay. Um, Mental health. We do have Canadian resources available. So Canadian Forces Member Assistance Program can give bilingual telephone support for CAF members and their family members that are posted outside Canada. They have a 24/7 mandate to answer a call, and then they'll triage to arrange services in your language of preference. Okay. This is meant for short term. Typically 10 to 12 visits is all that they're supposed to do, but they are very helpful in establishing those connections. There's also the MFS Family Council, Marion Hall. She's here to help all of the US population, and this is for family members only, so not service members. And her contact information is there. And then anytime at any place, 988 is the suicide crisis hotline for the United States. Pharmacy, medications. So this is a key point, is that your MTF pharmacy will fill all prescriptions. Doesn't matter if it started at the MTF or from a civilian provider, and you won't have any fees. So if you are seeing care off base, get to know your on-base pharmacy. It's going to save you lots of bills and it's going to save you lots of headaches. Some medications may require special authorization, so it's important to have your medical records from Canada that will help get you coverage. If you're on a brand name medication because you've tried a generic before and it didn't go well, if there's no records for that, TRICARE won't approve it unless you go try a generic again. So that's an important part, is to use your records from Canada to get that authorized. And then some medications are not available in the US. It's infrequent, but it does happen. So if this does happen, you can talk to your provider about alternates or contact myself and my team, and we'll try and help figure out a way to make sure you get your medications. If in doubt, you can find out what prescriptions are covered at that link. So referrals. Referrals are usually not required for our TRICARE Select. So our Select Group B, however, some doctors may request one. It's usually based upon their colleges. Physiotherapists need to have a referring doctor, so they're going to ask for a referral. If you're referred to a provider, you can check the TRICARE East or TRICARE West beneficiary portal for your referral authorization, or contact your MTF referrals manager. This is, again, someone who works alongside the BCAC, who helps manage those referrals if you're getting a denied referral or anything like that. If you ever need to find a provider, these are the links that will take you to a provider search. You put in your zip code, the type of doctor you're looking for, and it will do that. If you get a referral, do watch that, because they do expire. So if you do not activate the referral before it ends, then and it expires and you go, that care will be denied by TRICARE. And then you have to go get a referral again before they'll honor that claim. So some helpful tips and tricks, and we're coming to the last few slides here. So when you see doctors off base, it's very overwhelming, and I get it. I like with my family, we try and figure out ways to manage our copays and our bills when we're seeing people off base. But once you submit it to MSH International, it's like, how do I keep track? What's come back? And so this is like having a tracking spreadsheet is a very simple way to keep this going. We're actually going to put a copy of this spreadsheet up on our website for you to download. But this is a really simple one that says, like, on this date, Jaron on this date went and saw this provider, charged this much, TRICARE paid this much. I submitted it to MSH International, and then I can watch it, right? And if you color code it, then you know date paid by MSH International, amount paid, and if there's anything outstanding, and you can write your notes, denied because of, or error in the check, They sent it in Canadian funds, not US funds, and things like that. So this helps you keep track of this and stay on top of it. Okay. Some other helpful tips is when you submit a claim on that is record the claim number for the service to help you better track your claims. Sometimes MSH International will combine claims or they'll switch them around and it gets really hard to track. And so having all your claim numbers written down will make it easier when you contact them and you say, hey, on this claim number, I'm having a problem. If the claim was submitted under a different type of claim, say you accidentally submitted a prescription under a treatment, it will be closed by MSH International. They're going to close it and reopen it in the proper type, but you're not going to see that. And so you're going to have a hard time finding it. So having that original claim number is important. But looking through your claims portal to try and find it. And then once you find that, you'll see where they reclassified that, write that new claim number down. You can request a healthcare advance for any combination of bills over $400. Healthcare is expensive and insurance is not the fastest to pay you back. We get that. Don't carry medical costs if like as an added stress. The advance is an advance. It's from the crown, so it has to be repaid. However, we don't come running at you to get it repaid right away. We make sure we're working with you to try and get MSH International to make you whole so that you can make the advance whole. Okay. If you're communicating with MSH International on emails, they'll delete after 30 days. So take screenshots or print as a PDF so that you have a copy and a record of your communication with them. And then the last part is depositing checks from MSH International can be different from US institutions. So check with your bank because it's often a US dollars check cut from a Canadian institution. So it has different numbers on it. So quite often you have to go into a teller or you can contact, like for myself, I contacted RBC Bank online and just told them what it said and they gave me a different way to endorse it and then it worked. So these are things. The key point also is to know your benefits. So know your MSH International Public Service Healthcare Plan benefits, know your dental benefits, and know your TRICARE coverages. Because what you don't want to do is end up in a situation where you're seeking healthcare that's not going to be covered, and then you end up with a large cost that you didn't know ahead of time. Trouble happens. Claims get denied, things like that. Okay. We do have a support hierarchy. Initially, if it's not an emergency, so emergency is like medical emergency billing, massive billing, you get told it's going to collections, it's like a life-saving treatment, your multiple providers are denying you care, anything like that, immediately contact us, my team, that day, right? If it's a billing error, an unexpected bill, sort of you have a coverage dispute, I always recommend to go in person to the BCAC at your base. They're excellent in person. Over the phone, sometimes you don't necessarily get as much help as you may want, but every BCAC that we work with, and we meet them all across the US at every MTF we go to, they always are asking how they can help Canadians more. So go in person, right? They're going to help you deal with it. If they don't solve the problem, and usually it's sort of within 2 to 5 days, because sometimes they have to go back and forth with TriWest or a provider, then get in touch with us because we'll talk to that BCAC to try and better understand why it didn't get resolved. But then we also have contacts at higher levels to help sort things out. And so that's where we say, like, use the BCACs first, they're local. The next part is to talk to the team, and I'll go through the team here in a second. And then the last point is, like, if you're not getting an answer from my team, like, call me, email me, tell your service member to get in touch with me on Teams, whatever we have to do to help you. But don't wait months and months and months to try and sort some of this stuff out. We're here to help. So this is where I want to highlight some helps. The Patient Family Advisory Committee, and I'll get you guys, if you're online, to flip your cameras on just so people can see you. So as I said, I'm co-chair of it as a military member. Beth Senecola, who's down in Panama City, Florida, she's the other co-chair alongside me. We have Jen Paul, who just recently relocated to Vandenberg Space Force Base in California, however, has a wealth of experience being in Colorado Springs before that. Catherine Kellner Thompson is in Denver slash Buckley because Denver is Buckley and Buckley is Denver. Um, Tammy Hardy's in Colorado Springs. Warrant Officer Keith Richards is in Washington, D.C. at the embassy. Sergeant Ken Thompson is also located at Buckley Space Force Base. We have Corporal Durba Chakraborty, apologize. He's in Fort Meade. And then Master Corporal Kevin Ramkishore, he's in Alexandria and with me at the embassy, and then myself. So all of these people have invested interest in just improving healthcare in the US. And so they have a lot of knowledge and they are excellent resources to have locally. On our website is all their contact information as well. So you can contact someone who's in your area when you're facing an issue, or if you want to highlight something that you need brought up to our group. We're always looking for more people. So there's a link there to go and you can read more about what we do. My team, again, I'll get you to flip your cameras on as well again. So again, I'm the Canadian Forces Medical Liaison Officer. I'm a doctor by trade, but I'm down here to sort of help. I highlight that I'm a resource for CAF members and families, but I do have some limitations in that I can't provide medical advice directly to family members legally. I try and give you my best efforts to support you without providing direct medical advice, but I am here to really coordinate a lot of those high level things between us and Defense Health Agency or providers as well. Captain Tegan Rook is our newly posted in Health Services Admin Officer. So she's becoming a SME on TRICARE and sort of going through that whole process of coming to a new unit and figuring this all out. But she's quick as a whip and just finished her TRICARE course. So she's now actually better TRICARE trained than I am, which is great. And Master Corporal Kevin Ramkishore is my health services coordinator. He's a paramedic by trade, but he is the guy who can get you the answer or bug me enough that I get you the answer. So he's a great first point of contact. And then I do put Miss Natalia Pella. She's our medical records clerk for any of the military members that are there. So this is our last slide. It's got all of the links that I got in there, but the key point here, QR code, this is our website. I'm actually going to put it up here and give you a brief walkthrough. This was done with CFMWS, who's been an amazing partner to us. Newly launched, and some of our PFAC committee members are actually just seeing this for the first time too, which is kind of cool. So can I get a thumbs up that that's showing on the share screen, or just 1 second.
It's showing.
Is it? Okay. Awesome. So we've tried to simplify it so you can find the information you need right off your fingertips. So first step you're going to ask is, who are you? I'm a CAF member, so I could be on leave without pay or some other thing, or I'm a family member of a CAF member that's posted to the United States. And so we're going to go down here. Just before I click into it, we always have helpful hyperlinks and then bulletins that we send out throughout the year on different issues that have come up are going to always be on this front page. Patient Family Advisory Committee, just the plug, you can always connect with us there. So if you're a family member, you're going to open that up and it's going to say, okay, your sponsor, so the military member that you're down here works with the US military and you have TRICARE access, or they don't. And you're going to be fully public service healthcare plan, which may be a few of you on here, but we're going to go this way. So here we go. And this is where you're going to see all the information, hopefully, to answer 95% of your problems. If you don't find your information here, that's come to us right away. Just be like, hey, I was on your website. I couldn't find. And luckily, all of our emails and office phone numbers are located right here. Okay. But this goes through the fact that you're TRICARE Select Group B, but you don't have enrollment fees. DoD sponsored medical treatment facility care is available when space permits, off-base care with copays. You have public service. So then it's going to talk about your TRICARE status, your dental coverage, how it's all through public service dental coverage plan. It gives an explanation of excess dental. It talks about the forms that you need for dental claims. We go through access to health care. on base, off base. Um, and I see some people have said, hey, like pharmacies aren't filling off base prescriptions. In the chat, I saw that come up. We're going to link in with you because we're going to fix that because they have to by policy. That's just that's okay though. But anyways, and then we have scenarios. So maybe you're awaiting your TRICARE access, or you got a specialist referral off base. So we're going to be putting more of these. So I highlight this because this is a great sort of information resource, and I don't want people thinking like that they have to find all their answers on their own, but this is a great way that goes. Now, if you're so I just saw that question there. If you're a military member, there's information on glasses. Family members, we will actually put a spot up here because you are eligible for eye visits on base. Or eye visits at a civilian provider every 2 years covered by TRICARE, but just not glasses. Um, but then things like an emergency, what do you do? This is our emergency page. Or man, I just need to talk to one of you guys. You go to our contact directory. We have all the links there. We have all of our numbers here. So do bookmark this. I don't want to stress this enough that we're trying to really give you as much information and resources as possible. And with that, I will highlight that that is the end of the formal type of presentation, and I will say thank you to all that came out. We are going to stay on, myself and my team and the PFAC members, to answer questions. I know some people have been putting it up in the chat as well. But before we do that, I will say thank you for coming out, and I hope this was helpful. We do want to continue to build on more of these resources. So if you have suggestions for us, send them in, and we're happy to do it.